Vitamin D, also known as the sunshine vitamin, is a fat-soluble nutrient that supports the body's healthy functioning. It helps the body absorb calcium, magnesium, and phosphate. It also promotes bone health, teeth development, muscle function, immune function, cell growth, and glucose metabolism. In addition, adequate vitamin D intake reduces the risk of illnesses like multiple sclerosis, heart diseases, schizophrenia, depression, cancer, autoimmune diseases, and diabetes. According to the National Institute of Health, NIH, adults ages 19 to 70 need 600 IU of vitamin D, while adults over 70 need 800 IU daily. Some experts believe these intakes need to be higher in order to maintain optimal vitamin D blood levels. Other experts recommend personalizing your daily vitamin D needs based on your vitamin D blood levels. You can get vitamin D from sun exposure, diet, and supplements. The top dietary sources of vitamin D, according to the NIH, include 1 tablespoon of cod liver oil has 1,360 IU. 3 ounces of trout has 645 IU. 3 ounces of salmon has 570 IU. 1/2 cup of mushrooms has 366 IU. 1 large egg has 44 IU, with the vitamin D in the yolk. Vitamin D fortified foods such as milk at 120 IU or cereal around 80 IU. Many people may struggle to meet their vitamin D needs by relying solely on vitamin D-rich foods. The sun supplies about 50 to 90% of our intake. Experts suggest that sensible sun exposure, about 50% of what may lead to mild sunburn, is an excellent vitamin D source. Other researchers recommend spending 20 minutes a day with 40% of the body exposed to sunlight to maintain adequate vitamin D. The amount of vitamin D you get from sun exposure depends on a lot of factors, such as age, skin tone, where you live, weight, genetics, time of day, amount of skin exposure, and many others. However, certain groups of people are at an increased risk of vitamin D deficiency and may need supplementation to meet their recommended intake. They include exclusively breastfed infants. Breast milk supplies only about 25 IU to 78 IU. Older adults, as their body cannot effectively synthesize vitamin D and they're more likely to live indoors. People with limited sun exposure resulting from lifestyle factors like working indoors, wearing clothing covering almost every part of the body, or living in regions with poor sunlight. People with dark skin, as melanin reduces the skin's ability to produce vitamin D from sunlight. People with conditions associated with malabsorption, such as gastric bypass, inflammatory bowel disease, chronic liver disease, celiac disease, cystic fibrosis, and others may not absorb vitamin D efficiently. People on some medications may affect vitamin D absorption. People with obesity may need more vitamin D compared to others to reach optimal levels, as a BMI of 30 is associated with lower vitamin D levels. Many people fall under these categories. In fact, vitamin D deficiency is a significant public health issue among all age groups globally. According to research, 1 billion people globally and 3/4 of people in the US don't get enough vitamin D. This deficiency is associated with some of the leading causes of death, like heart disease and cancer. Therefore, it's crucial to regularly check your vitamin D levels and take supplements as appropriate to meet optimal vitamin D status.